Brantford Mayor Kevin Davis joins us with an update of what's happening in the city. Things not great at Brantford General Hospital, really understaffed.
Yeah, there are a couple of things going on there. So first of all, we at the city, we don't run the hospital. We're not involved in operating it.
Provincial.
But I am involved in the paramedic system through the County of Brant. So I have some information what's going on there. And it's a couple of different factors. One is the province-wide shortage of nurses. Another big factor is the lack of family doctors, and so a lot of people who don't have a family doctor, if they got a problem, they end up going to the emergency
hospital,
department,
yeah.
right? And so at the city, we're working on an interesting proposal to bring more physicians to Brantford. But part of it is that the emergency department is being reconstructed. So it's a construction site.
Yeah.
And it's really challenging for the staff there to work around it. And then also, they haven't had a permanent president or executive director for over a year now. But they've just hired Bonnie Cam from Cambridge Memorial. And she's now been in place for about a month. And I know this is a top priority for her, having spoken to her. And also, I think there are representatives from the Ministry of Health that are helping out. So we're hoping the situation, in particular in the emergency department, will improve hopefully over the next 6 months. And we at the city, we're doing whatever we can in a supportive role to help them.
Okay, and shout out to the staff there because my mom was there a couple of years ago and just terrific care.
You can imagine as a nurse trying to work around a construction site. That's pretty hard to do.
Okay, still with health, the Brant County Health Unit and Haldimand-Norfolk County Health Unit, there are talks about a merger.
Right. Yes, there are talks about a merger.
Tell me about that.
Well, I don't really know much about what the talks are because we pay at the city, we pay about 30% of the local bill. We share it with the County of Brant. And what's happening is there is a proposed merger with Haldimand-Norfolk. And the province has really been pushing that hard because they want fewer health units. After the pandemic, I suspect they think, one, there'll be cost efficiencies, and two, it'll be easier to control a smaller number of health units. So for us at the city, the question has been, will this merger benefit the city of Brantford? And we haven't been getting much in the way of information from the health unit. And I think that's because probably there are talks with Haldimand-Norfolk in the province that, well, they're all in camera. And so we do have 3 members in our council that sit there, but because all the discussions are in camera, they can't tell us
They can't talk about it.
All right. And so we at City Council, all we're asking for is tell us what it's about, tell us how it's going to benefit Brantford, and when, please come and tell us what it's all about so we can decide whether or not it's something we want to support. Because my fear is that once this is all finished, we'll have a public health unit that has less of a focus on Brantford and will cost us more, and we'll have less of a say from the city how it's actually governed. But it can be resolved pretty easily if the province and the health unit would tell us, once we have a proposed merger deal, we'll come to City Council, we'll explain it to you, and that, yes, we'll need your consent. I mean, that would resolve the controversy.
Okay. Great news about your public transit system.
Yeah, we have staff running our public transit system. They're just knocking it out of the park. What other transit system in Ontario has 25% more riders than the year before the pandemic? Like that's incredible.
Really?
Yeah, that's incredible. And that's because we got great staff running the system, and because the system is working reasonably well, people are using it. But we know we can improve it, and so we've just done a study that getting kind of general information for people what they want in a transit system. Now the transit staff, led by Mike Spicer, they've come up with a detailed plan. And there's a great website where people can go into the website and they can see how the routes are going to change in their neighborhood, how the fare system's going to change. And so we're going through a pretty detailed public consultation process on the plan. And I think the end result is going to be an even better transit system with higher ridership.
And that's really important for getting people to move into the city, right? If you're thinking about moving, you live in a city that has a transit system, you want to see in the next city you're going to live in what that transit system is like if you use it.
Yeah, for sure. And we have a lot of students with Conestoga and Laurier, and many of them rely on the bus system. And we also have a number of new businesses. And so for many of them, their employees rely on the transit system. So we're trying to design a transit system that gives people more direct connection between their home and where they work or where they shop.
Okay. We've got about 30 seconds left. You've got fireworks coming up.
Yeah, fireworks is often, well, we have rules about fireworks.
Yes.
Some people think we shouldn't have any fireworks, but we do have rules. And so for Victoria Day, you can begin tonight, starting at sunset.
Okay, this is in the city of Brantford.
In the city of Brantford, continue until 11 p.m. You have to let them off on your own property, and you have to be more than 18. And you can do it tonight, tomorrow night, Sunday night, and on Victoria Day.
Okay.
But beyond that, you're not supposed to be using fireworks.
For the rest of the year?
No, Canada Day.
Canada Day,
Same
okay.
rules. And Diwali for one day.
Yes, yep.
November 1st. And also the Chinese New Year.
Okay. All right. Can't wait till you're back in June, because you've got really, really big good news.
We do.
We do. We'll leave it at that.
We'll leave it till then.
Okay.